Hi guys, my name is Steven. Here I'm massage therapist at the Kinesis Health Associates. Today we're going to talk about a technique that I love to use on specific patients, such as like athletes, people that are basically having headaches and all that stuff, those chronic issues. Technique basically called Gua Sha. Some people refer it as instrument-assisted soft tissue manipulation. And there's also a big name that a lot of people hear about, which is Grafting. It's kind of like a modification of it, but the end results are the same. Indications of it basically very simple. Stagnation, so basically people that are limited in some terms of range of motion, such as like the stretches, well, my neck won't go just like too far. That's an indication where you can use some scraping instruments. There's a few out there on the market, but usually I use these simple ones, like it could be plastic, metal, wood, whatever you want. It can also be stone. Side effects that basically people can see, definitely redness of the skin, and then you can get some pigmentation as well. Kind of leaves a little bit of a bruise, but it goes away in a couple days. Skin can be also a little bit tender after the treatment and following days, but again, nothing that is not indicated. So here I'm just going to do a little quick assessment of my patient. I'm going to see how our neck is moving, see if basically we are indicated or not to use this type of technique. So right here we're just going to basically ask my patient, bring your right ear to your right shoulder. Pretty good. And then to the other side. So we're getting a little bit of limitation here happening in terms of that right side neck. So that's one key point where we can use it. Now I'll get you to bring basically a side tilt. So lateral flexion. That's good. And the other side. That's also good. Still getting a little bit of like restriction in terms of the tissue. So protocols for me, very simple. I'll apply a little bit of medium, like lotion, just to kind of like help with the glide. You don't want to use those tools just on the skin because you could irritate it really fast and leave a good mark, which we don't want. So I'm going to start very simple here. Just use my handy Gua Sha tool, right? This one I'm going to use a plastic one. Just apply a little bit of lotion on the neck, bring this down, and then very simple. You can do it two ways. Slow but soft, and then you can go really pushing that neck in a stretch position and really going the whole length of that muscle, but also that's tissue. Softly but surely, you kind of start seeing some redness happening, which is totally normal. That's what you want. It's an increased blood flow basically to the area. And here I'm not pressing like very hard, just to say that I'm kind of like gliding over the skin, and I don't think my patient like thinks it's too much either. I've been doing this for about 5 to 10 minutes, no more than that, because obviously you don't want to cause too much. You can also go fast to increase some blood flow. It also helps to break up some scar tissue. There. Good. I'm just going to switch sides and then kind of like bring this way. Yeah, that's okay. There, and then kind of go right down. Going a little bit harder on this part of their scapula, just to really get into it. And whenever like the skin kind of like gets dry, just reapply some lotion. And then just keep going. And from there, basically we can get some little pigmentation, basically just like little blood cells that are popping, and that's what I was talking about just now. Look at my patient to come back to neutral position. So this was about maybe like 30 seconds to a minute of treatment. We're just going to retest here. So I'll get her to turn her neck to the left side and see how much more range she's getting just for that simple little bit of a treatment. And you can come back. And now I'm going to get you to lateral reflex to the left. And here is about the same. We're still getting some stuff in the front of the neck. I continue basically working in that tissue, but we can definitely see that increase of range of motion just with her rotation. Things that I would tell my patient to basically do when they get home, just simply add some heat, right? You can lightly stretch it in the same direction, but that's about it.